UBC, inspiring Uganda.
Ni MTN Kabode Super as you pay mpola for this smartphone. Make calls, update your WhatsApp status, watch YouTube, and Google anything under the sun with 2 GB worth of data every month for 7 months. Simply make a small deposit of 99k and pay the balance mpola. You can pay in daily, weekly, or even monthly installments while you enjoy your new phone. So what are you doing today? Visit any MTN shop near you and get the MTN Kabode Super easy.
UBC, inspiring Uganda.
Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Have you ever suffered a type of pain in any part of your body that never seems to go away, despite taking numerous medications? Are you the type that experiences chronic back pains due to oversitting? Or maybe you have discomfort in your knees or legs after overstanding or walking. Did you know that even without medication, without the painkillers such as the diclofenac and the likes, you can still manage that pain? Please welcome with me in studio a sports therapist, Mr. Sina Ismail from Activate Body Therapy Clinic, to tell us more about how we can control pain without the need of pain medications. You're most welcome, Mr. Sina.
Thank you.
And joining us is a special guest, Miss Jolie, to tell us about her experience with pains, with these chronic pains. Despite taking numerous medications, she doesn't seem to get relief. How has she been able to overcome this problem? So you're most welcome, Miss Jolie.
Thank you.
Yes, and I am your host again for the evening, Dr. Darius Sawachi. So we can start off with telling the viewers what your story has been with these pains.
I have had pain for the past 4 months, really.
Okay.
And it was something simple. It was in my knee. And I think maybe the way I was doing gym, certain exercises, with time the pain became intense, chronic, yeah?
Okay.
And I was taking medication. I was doing the painkillers. Every time I wanted to go for a run, my knee would hurt. So I actually went to a hospital and I did the scans and I was told that I needed to do surgery.
Oh,
yeah.
Okay.
But I was not up for surgery. No, I was
surgery
not okay.
was out of the way for you.
Yes.
You were like, that is a no-go area.
Yeah, I was like, maybe the body can heal naturally. So being a .com kind of person, I was on the internet and I was Googling, and then I found that there's something called sports therapy. Then I was like, in Uganda, I was surprised that there was someone who does sports therapy.
Okay.
And that's how I was able to go to Dr. Sina, to his clinic, Activate Body Therapy. And I met Dr. Sina, and he promised me that I would heal.
Wow.
In all honesty, I thought I wouldn't, because after hearing a bit of surgery, I wasn't sure.
Okay, but I want to understand now the impact of this pain. How did it affect your life?
Whenever I would sit for long, as if my knee would lock, you know that feeling, yeah? When it came to running, I couldn't run anymore. So I couldn't do my normal physical exercises, the way my life was. And I travel long distances, so after driving a long distance, my knee would hurt.
Wow.
Even sleeping actually in the morning, because
no problem.
every time I would rest the leg in a particular position, in the morning it has looked as if. So my life was a bit frustrating, really.
Yeah. So Dr. Sina, how did you handle Miss Jolie's case?
So the first thing immediately, I was to do some assessment. You remember?
Yes.
So I got her to lie on the couch, got the knee, so I flexed the knee. So basically I bent the knee and then straightened the knee and said, do you feel any pain? And she said to me, not really, I don't feel pain. Do you feel any locking? And she said, no, I don't feel any locking. So then after that, I start working on the muscles, try to find alignment of the muscles, how the muscles are structured. So I tried to feel all the muscles. So when I felt the muscles, she was very tight. Everywhere was pain.
Yeah.
And we even went through the back, we tested the shoulders, we tested everything. And I come up to the conclusion that, Jolly, you basically got discomfort, which is muscular pain.
Muscle pain.
Yeah.
So she didn't need an operation at that point.
Yeah, so I said to her, I don't think you're going to need an operation. I said, however, if you think you do, try to go for second scan, just to make sure. Or I can work on you. And then she goes, you can work on me. So she gave me that.
So with your permission, if you'd allow, that he can demonstrate exactly what it feels like to be in a consultation with a sports therapist and what treatments they might administer. Is that okay?
That's fine.
All right. Yes.
Okay. So if you can lie down on your back, so when I lay her in this position, she won't be able to put any weight on the knee.
Okay.
So what we did, we bent her knee, and I asked Jolie, do you feel any pain? She said no. I said, okay, so if you can lift your foot in this position, do you feel any knee pain? She said no. Then I said, okay, you can straighten the knee, no pain, okay. I said, can we do some rotation? Do you feel any knee pain? No. So then immediately I knew it must be muscle alignment. So I started checking all these muscles around the hip, checking these muscles, checking the muscles around below the knee, and also I checked the back as well. So I did the whole assessment on the body.
Okay. So how did you know? How did you know that the muscles of the knee were not aligned?
Aligned.
Yes.
Because I palpated. So basically I press. So if we do this, if you're in pain, you feel the pain.
Okay. When you're moving
When
the
I'm
muscles.
moving, when I'm moving the muscle, just feeling the muscle in this position, you can feel the pain. So she
Do you
immediately.
feel any pain, Joel?
No, but that time,
At that time, I was screaming.
it was, it was very, it was
Even
terrible.
just to put just pressure here,
Yeah.
this position here, she'll feel pain. Even on the arm, so even on the feet, everywhere, even on the back. So I said immediately, once I finished the assessment, I sat Jolly down and said, look, we're going to have to look at the body as a whole. So there's no point of me fixing the knee because everything is connected. So what I did, I worked on it, which is slightly sports therapy. It's more applying more pressure onto the muscle, try to loosen out the muscle. So it's slightly discomfort, but the way we work, or the way I work, I try to make sure I work with the patient to make sure he's able to take the pain, the level of the pain. If it's too severe and the client guides me and says this is too much, I tend to lower the pain. So then we work on that because we've got stages.
Because people might think the treatment you're talking about, loosening the muscles, is the same as massage. Are they the same?
They're kind of similar, but one's more intense. One is you apply more pressure.
Okay.
So this one, so if I was to apply more pressure, there's some people scream, you know, just basically just causes a little bit of discomfort, but it gets better. You get the oil, which is a lot, it's got inside. So we put on our hand, so we work on the area. By this one, by the time you finish, so you can see.
It quickly enters the skin.
Yes, so
Okay.
you can see from here. So we worked on the knee in this format.
Do these oils, can they enter the bones?
Yeah, they
and
go into the
joints?
muscle, so they absorb into the body.
Into the body.
Yes.
Any side effects? You know, people are very concerned these
No,
days
no,
about
there's-
side effects.
No, there isn't any side effects.
Okay.
Yeah, so it's just there's no side effects to it.
Awesome.
And it doesn't cause any itching, it doesn't. And if you've used other oils, sometimes they cause itching, so it's discomfort, and sometimes it can cause a rash. But this has not. I've used it for over 15 years,
Awesome.
so it hasn't got. But also in terms of like when you're working on this kind of treatment, the reason why it's different to relaxation or massage that you described, this one involves following the muscle structure. You have to know the muscles, you have to know the bones, and also you have to know injuries.
We learned that certain types of activities we do, like the physical sports, can inflict injuries on the joints and the muscles of your legs or in the hands. So we want to learn from Jolie. What take-home message, what advice can you give people? You know, people these days are so interested in keeping fit. They want to lift weights and, you know, go for marathons. What advice can you give them?
Yeah, from a personal experience, it's very key to have the right posture in the gym when you're doing any form of exercise. You have to make sure that you're not weighing your body down. You know, some people carry their weights and they weigh their knees down. Yeah, and then if you have pain, do not hesitate. Yeah, pain is an indication of something serious.
Okay.
Any slight pain, please consult the therapist or anyone.
Yes. So so if someone is in the gym or someone is doing sports, you know, or jogging, running, and they feel some kind of pain, even if it's little, they shouldn't take it lightly.
Yeah, they shouldn't.
Okay.
Yeah.
All right. So, and Mr. Sin, what would happen if they take it lightly?
If they take it lightly, it's just because normally the pain starts, you get a warning sign. And the more you leave it, you ignore it, the worse it gets. And then before you know it, it's turned into chronic pain. And if it's left untreated again, and you live with it, then you're going to have injuries, which can lead to tear. And that tear can lead to operation.
Okay. So does gym bring about chronic pain? More about that coming shortly after the break.
You are watching the Doctalk Show.
A good school doesn't tolerate violence against children.
Because a good school equals a better life.
Raising voices.
You are watching the Doctalk Show.
Welcome back from the break. With me is a powerful team of gentlemen who are experts in pain management without the need of using medication. Yes, there are various ways you can control that pain that has been aching. Perhaps maybe your back pain, your knee pain, or any part of your body. So I want to hear from them, from the experts, to tell us exactly how they go about in controlling patients' pain without having to prescribe medication. So on my immediate right is Mr. Sebwana Charles, a practicing chiropractor. This is a field of therapy that deals with bone and muscle alignment. And on his right is Mr. Solomon Kayondo, a practicing physiotherapist from Kampala Hospital, and of course Mr. Sina Ismail from Activate Body Therapy Center, who was with us in the earlier segment. So you're most welcome to the show, gentlemen.
Thank you.
Yes, so today's topic focuses on pain relief, and as you listened in the previous just before we went for the break, Miss Jolie had the problem of chronic pain in her knee as a result of excessive physical activity, probably resulting from uncontrolled forces exerted on the joints. So I want to understand, maybe we'll first start with understanding what exactly they do and how it relates to controlling pain management. So Mr. Charles, for example, I'll start with you. In this field of chiropractic, maybe you could help the people understand what exactly is it. What is a chiropractor? What is chiropractic?
Chiropractic is a healthcare profession concerned with the diagnosing and treatment of neuromusculoskeletal disorders. I'll simplify that. Neuro to do with the nerves, muscles. Earlier in the program, somebody was talking a lot about muscles, and skeletal is to do with the bones.
So the bones.
So chiropractic specialize in managing conditions in that category.
Okay.
And we use conservative means to handle those problems, symptoms related to that problems, including pain.
Okay, so excellent. And so, Mr. Kayondo, you are a physiotherapist. Yes. I know, people might be familiar with physiotherapy, but they may not really understand what it means. What does physiotherapy mean? They know the term, but they do not know what it means.
Physiotherapy is basically the assessment, treatment, and diagnosis and treatment of physical disorders using mechanical means or physical means. And by mechanical means, we can use exercises, the other means which include like electrotherapy, those fall under all physical, not using medicine, but physical means to treat pain.
So kind of physical maneuvers to
to
exercise
manage
the muscles and
muscles,
the joints.
yeah.
All right. So to start off this discussion, we are talking about pains that tend to disturb patients. They take lots of medications and nothing seems to be working. These are the chronic pains. For example, the sports injury, you got that injury in the gym, as Miss Jolie explained, she had pain for 4 months, taken lots of painkillers, nothing is happening. Or Mr. Savana, in your clinic, you might see patients who are complaining of severe back pain. They are swallowing lots of medicines, nothing really is happening. So I want to understand what exactly is pain. Why do people experience pain?
Pain, in simple terms, is one of the symptoms coming from body ailments. There are other symptoms, but pain is one of them. And is experienced as pain as we know it. We can't define it more, but pain is pain. It disturbs. When you have pain, you are very uncomfortable, you can't do anything, and sometimes the condition is so bad that you cannot do anything, and you are in agony, you are suffering, and that's pain. And it brings a lot of misery to the people, and that's why we are here to try to tell the public what pain is all about and what we can do to help at least people overcome pain.
Okay. So when you talk about, well, I know there are different types of pain. There's what they call the chronic pain. What does that mean exactly?
Usually, when there is a pain as a symptom, it starts in form of acute, when it's new, when it's still very painful. But later on, when the body has managed to silence it a bit, it becomes chronic. And if it's not handled, it continues disturbing the person, and it can even lead to disability.
So, Dr. Sina,
yes.
Regarding chronic pain, why do people get such pains?
So the reason why people get chronic pain is because obviously it goes through an acute phase where people ignore. It's always, when I'm dealing with clients, I always say, every time you get acute pain, deal with it immediately. If you don't, then it goes into chronic pain.
It becomes chronic.
Yes,
so it always starts with acute, then it goes to chronic.
And most people, they've got this, because they don't know where to go, they always think, okay, I'm going to live with the pain. And some people associate that with age, which I completely disagree. So pain has to be managed. As Dr. Sabwan has said, we have to manage the pain. And pain is a signal to your body, something's not right. It's like you having your car and the dashboard lights, and it shows that the brakes are not working. So you fix the brake. So with pain, once you get acute phase, please fix it.
Okay, all right. Mr. Solomon, so in your practice as a physiotherapist, are there particular conditions that you see people coming to you regarding pain? Which are the common conditions that you see? That you as a physiotherapist, you've had to work on to try and relieve the pain?
As a physiotherapist, I deal mostly with physical. Like my main concern with the patient or client is how they walk. So pain might be caused by movement. Like if someone has osteoarthritis, they can't move very well. So they're having pain because there is something in their bones, but they can't move their muscles that well. So they'll get chronic pain. So they will not work or not do things they are supposed to do because of pain. So you see a lot of chronic pains in arthritis. This is a medical condition which translates into a physical manifestation. Then back pains. You get neck pains, a lot of neck pains. And other sports-related pains, which is due to an injury.
Okay.
Yeah.
All right. Yeah, and just, so I know we're talking more about physical pain, but there are also other types of pain. For example, psychological pain resulting from either a stressful event or a loss of a loved one, or that can cause the type of pain which may not be a physical manifestation as a joint pain, but you feel pain in your mental well-being. So there's what they call psychological pain, as well as spiritual pain, pain to do with your spiritual sense. What gives spirituality, we usually define it as what brings meaning to your life. So if you have lost that sense of meaning in your life, you have lost all hope for living, we call that spiritual pain. So there are different types of pain, but particularly I want to discuss physical pain and chronic pain. So after the break, we'll come back to understand more about how these specialists manage chronic pains of their clients. You have had there are different types of therapies, chiropractics, there are the physiotherapists, the sports therapists. So I want to understand exactly how each of them addresses the issue of controlling pain. Don't go away, we'll be right back after the break.
You are watching the Doctalk Show.
I remember the lockdown, when the streets were empty and our lives disrupted, when businesses closed and our livelihoods hung in the balance. Hospitals were full. We lost loved ones, jobs, and hope. Our children couldn't study anymore. We cannot let this happen again. We should not go back. Get fully vaccinated against COVID-19 and join the millions of Ugandans who are already vaccinated.
You are watching the Doctalk Show.
There are several types of pains that you might experience in your lifetime. You have the physical pain, which results from an actual injury to your body. You can have the psychological pain, which is a distress to your mental well-being. Spiritual pain as well, relating to your mental well-being. So with me are a team of experts who deal in addressing physical pain. And the good thing about it is they do not require medications. Yes, you don't have to take all those numerous medications such as the painkillers, the morphines, or the Panadols that most people are accustomed to. We are discussing pain control without the need of medication. So to further understand, I want them to explain how exactly they feel, how exactly they relieve pain in their particular fields, which kind of people are supposed to see, for example, with physiotherapists versus vis-a-vis sports therapist, vis-a-vis chiropractor. So we'll start perhaps with you, Dr. Kayondo. A physiotherapist, I know it's a very, very common field and many people are familiar with it. We commonly see, doctors commonly prescribe that as a way to increase muscle function, like in situations of stroke. But how exactly does physiotherapy address pain control?
Okay, thank you very much. Physiotherapy, as you said, is a broad medical profession, but I'll focus only on issues of muscles because we're talking about muscle pain. So in cases like you've said, stroke, if the limb is not moving, if you've got a stroke, your body parts are not moving. That means you're not using your muscles. So there is potential for muscles to shorten, and when they shorten, the joints get stiff. So the moment you try, it's like you're starting from scratch. You're trying to this is a glue, and then you're trying to unglue it. So they're going to have pain. So physiotherapy helps you in your ailment or in your stroke, keep you moving, keep the muscles moving. Because our bodies are not meant to be in a static posture. They're supposed to be moving straight.
So every patient who has the unfortunate experience of experiencing a stroke must see a physiotherapist?
Yeah, that's very true.
Okay.
low back pain, which Dr. Sawana also addresses. But me, I would look. I may look at how you sit, the posture corrections, because it involves posture as well, like inactivity, like getting you back to activity. Like inactivity causes a lot. When you sit, you're inactive, so it may be leading to your pain. So I may help you be active even in your office, like how you can stretch and like get up and stretch and do things like that. So like in osteoarthritis, some other cases like osteoarthritis, like we pretend not to, like when you're having pain, we withdraw. So you don't want to use the joint because there is pain, but you're accumulating more pain in the joint.
Okay,
So
maybe just to understand osteoarthritis.
Okay.
What?
The osteoarthritis is bone disease, like wear and tear. It might be caused by infection or wear and tear. So your bones, your joints are not moving as they were, or like they're rubbing on each other. So there is inflammation in the joint. So if there is inflammation, you would not want to use them because there is pain. Whenever you move, there is pain. But things like hydrotherapy, like if you do it in a pool, there is buoyancy, helps you to move your joints with less pain. So my aim is like movement. I focus on movement, how you move.
Amazing. So how you move and how you sit might cause that chronic pain you're suffering from. So it might be good to visit the office of a physiotherapist to advise you on what to do with that pain. But I'm curious now, Mr. Sinna, you're a sports therapist, so for a moment it almost seems like physiotherapy resembles sports therapy. What is the difference between the two?
Not a difference.
Yes.
So it's kind of attached onto all of the subjects. So the chiropractor. So my service is sports therapy and also use exercise in terms of that. So the difference is, again, as a professionals, we always do consultation. We do assessments. So partly you do part of the assessments, we do static assessments, we do dynamic assessments, which I'm sure Solomon, Charles, they do. Okay? So then once we establish the assessment, the treatment is kind of similar, but at the same time different. So as I demonstrated earlier, that I use manual therapy, which is basically working on the muscles. So I can work on the muscles either using sports massage to break down the tissues and in order to align the tissues.
Okay.
Then after the tissues are soft and aligned, I use mobility work, manipulation of the joints, promote the range of motion. Then once that's finished, then I pass on to Dr. Sawana to align your spine alignment. Then once that's finished, again I pass on to Solomon to do some physio work.
Okay.
Then when the two finishes, then they come back to me, I start doing exercise. So we do the rebuild.
Okay. So it's kind of an interconnected thing.
Yes.
So you might be specialized in a particular field of sports injury, but you need the service of the chiropractic or the services of the physiotherapist to help the patient improve.
Yeah, so in order to get a complete alignment and also to be pain-free, you need more than one specialist. You can have one specialist, but that will be only temporary. But if you're looking to move the pain completely and give a patient understanding, this is where it comes in. So you have to look at other people to come in.
Okay, so Dr. Sabwana, your field is relatively new, I think, in people's understanding and experience. They have never really heard of something called chiropractic. So I know you've explained it to do with diseases of the nerves, the bones, and the skeleton. So how exactly does it address pains, for example, pains of the nerves?
Chiropractic mainly emphasizes the mechanical component of it. The body is a locomotor system. So, and the environment in which the body operates is not ideal. So the body is vulnerable. In easy way to move to exploit the environment is vulnerable to mechanical disorders, what we call biomechanical disorders, and the problems related to mechanical causes. So that's where we come in. As I said, chiropractor, we tend to see patients directly from community. We can be referred to, no problem, and collaborating with other practitioners, but the difference between a chiropractor and a physiotherapist, and maybe even sports specialist, like what Mr. Sina does, is we tend to receive patients from the community, whereby we have the role and duty of evaluating the patient, come up with a diagnosis and plan of management.
How about versus orthopedic? How do they relate?
Orthopedic tend to deal, they also deal with the musculoskeletal disorders, but mainly for our differences, for us we deal with mechanical problems. And orthopedic people, or orthopedic practitioners, tend to deal with the traumas, broken bones, and other diseases, inflammatory processes, or even cancers affecting the bone. They work hand in hand with
mainly the surgeons.
Physicians and their surgeons, as you put it.
So the chiropractors do not do surgery?
We don't do surgery, and we don't prescribe medication. But we offer all forms of other treatment approaches to address mechanical disorders of the body, especially the spine and pelvis.
What are the examples of the mechanical problems the spine can easily get?
Yeah, those are the various strains which the spine can face. As we say that the body, the environment in which we operate is not ideal. There are many things which affect the body as we live, we move in the environment. Like as my colleagues have said, the kind of roads we use, the posture faults, sitting at work, all of those also contribute to mechanical situations which affect the body, particularly the spine. Because the spine is the frame of the body on which other body parts are built in terms of musculoskeletal system. So when we assess the spine and see those mechanical disorders, then we make our plan of management. And our treatment approach normally involves, one of my colleagues has said manual techniques. But in chiropractic, we use the term adjustment, or some people call it manipulation. So we determine areas of the spine or an other musculoskeletal system which is affected by those mechanical disorders and contributing to the pain and other symptoms. So then we come up with our techniques which have evolved over years of chiropractic existence. The number of them there is no time to go over them. So we use those manipulative techniques to address those mechanical disorders of the musculoskeletal system, basically to alleviate pain, as we said, but also to address other symptoms like improved ranges of motion, and also there is what we call a proprioceptive input to the joints. When we do those maneuvers, we add proprioceptive input to the nerve ends,
kind of improving the sensitivity in the joints.
Fire somewhere. There is a theory we call it pain gateway theory. That is a very important.
I think we shall come more to that theory because we have to go for a short break. But yes, I think we can understand the diversity in the treatment options that are available to controlling chronic pain. So after the break, we shall tell you exactly where you should go if you are experiencing a certain type of pain. Who should you start with? And how can you know it is time to see either a physiotherapist or an orthopedic or a sports therapist or a chiropractor? So don't go away. We'll be right back after the break.
You are watching the Doctalk Show.
Nivana wafe twenywele, nivana wafe twenywele, nivana wafe tunyola. Eish, 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 twenywele, nivana wafe tunyola. Fomogo, kumala kenyota.
Nirvana packaged drinking water is a product of Crown Beverages Limited, makers of Pepsi products. That's life. That's Nirvana.
You You are watching the Doctalk show.
As doctors, we understand patients go through a whole lot of distress dealing with chronic pains. So I want to know at which point in their life should they consider seeing, for example, a sports therapist, a physiotherapist, or a chiropractor to help relieve their pain. So I want to understand from the experts with us in studio, at what points should the patients who are continuously seeing a doctor but not getting relief of their painful symptoms, when should they go see a physiotherapist, for example, or a sport therapist? So maybe Dr. Sina, you can break the ground here. Could you, when should a patient who has been seeing a doctor,
yes,
but they're not really getting much relief, at what point should they decide they must see an alternative specialist?
So the best time to see is when the pain is not going away and they've tried everything. They've tried the medicine, it's not working.
Yes.
So then that's the route, that's the time, that's the decision they take to see someone else, you know, like a specialist who can deal with that. So as we mentioned before, we've got a number of specialists. And due to my experience, over 15 years of experience working in this field, I've, you know, working with other doctors, working with sports, working with medics, this is what I think would be the best. Yeah. So assume once you've done assessments and you find someone's posture is not correct, so you know what causes the posture, so which is tightness, muscle tightness. So I would recommend the person to see a sports therapist.
Okay.
Then once the sports therapist aligns the muscle, the muscle is looser, the posture is improved, is able to do more movement at ease. Okay. Then I will send them to a chiropractor, depending. If it's a spinal problem, like back pain, I'll send them to a chiropractor. The chiropractor then will realign the spine. Then I'll send to a physio to do some physio work and also to make sure cover all the other areas that we haven't covered. Then after that, once the body alignment has been achieved, then I'll recommend that particular person to go and do exercise, specialist exercise.
Specialist exercise. If the pain is not going away despite taking your pain medications, it's probably advisable you should start with a sports therapist, because in your field you deal with injuries.
Yes, I deal with injuries
to the muscles.
I also deal with biomechanical, so people not walking properly, that sustain injuries. So things like that. So I'll look through that. So once we do the assessments, then we correct. Our aim is to get the posture alignment.
All right.
And also posture alignment can be achieved by aligning the muscles that are tight and also getting them activated.
Right.
So which switching them on.
Okay.
And that's why, because I believe in that, that's why I'd activate. You know, we understand all these therapists are very difficult to find. You know, you have to go everywhere. Around Mulago, you have to go to Kololo, you have to go somewhere else. So I activate. We realize in order for a client or a patient to be well treated, we created that service where you got a team of specialists there to look after you.
All right, at Activate Body Therapy Clinic.
Yes.
All right, so at what point do we get to see a physiotherapist, Mr. Solomon?
You would have visited my work, like releasing the muscle tension. So like I'll be working with muscles which are able to move. Yeah, okay, so
not the injured muscles?
They may be still injured, so that maybe I would use other modalities like ultrasound to help heal the muscle faster, or like electrotherapy, like TENS to stimulate the muscle as well. Then like I deal with movement, getting you back to the normal range of movement. I'll strengthen your muscle, build endurance so that you're able to be as you are before. Okay. So if your muscles are strong, you'll be able to move better.
All right, so I think they usually work hand in hand with the sports therapist and with the rest of the doctors. Yeah. Okay. And so finally, the chiropractics, yes.
Yeah.
At what point do we send someone to see the chiropractic?
To me, they can come at all levels. Mine is to do with the spinal and musculoskeletal disorders. The bones, because of mechanical problems, as we said, environmental issues, they are predisposed to mechanical issues. They are not working the way they are
which
supposed
which
to
mechanical
work.
issues?
For example, the spine. The way it is, it's not in order because of the factors which you have mentioned which lead to pain. So we assess the spine, see how it look like, the curves which are there, and other what we call, in chiropractic language, we call it a subluxation, or we can call it a mechanical reason. You motion palpate the spine, even other joints, and see that segment is not moving the way it's supposed to move. That's the mechanical reason. So we come in with our chiropractic techniques to address those mechanical reasons of the spine and other musculoskeletal system. And once those are corrected, then the spine and the rest of the body can function better, and it can overcome the symptoms and ailments affecting the body, like the pain.
Excellent. So remember, these therapies do not require the use of medication, and they don't require the use of surgery. So they are therapies which can assist the patient after you've seen a medical doctor, and probably they have done the surgeries, they have prescribed treatments, nothing seems to be happening. We can consider referring you to the alternative specialists. Where can the medical practitioners access therapists like you in order to refer clients to you?
So where the patients or the doctors?
Yeah, the doctors.
Yes, the doctors, they can, at the moment we're on social media. We know so many platforms where you can find that. Now, with the help of Google, we're able to search. And even when you look at the patient that was here before, you could find out just on going on Google. Just type in activate body therapy, and then you find it. Or you type in a physiotherapy, so many in the list will come up, and then you can just go through that.
I think it's the same for the patients. Both doctors and patients can still get information. But there are physical places like sports centers where they can, like clinics where they can get the services from?
No, the only one that we've created now is just fairly new, which is Activate Body Therapy.
Activate Body Therapy.
It also combines the exercise side of it. So we do some rehabilitation work on there. So we got therapists that come in, to make sure that the client or the patient gets better service and also get treated.
Okay. How about the physiotherapist, Mr. Solomon?
Physiotherapists are found everywhere, like in the hospital settings, in clinics, private clinics, like we always go there, but like everywhere, like a doctor would refer to a physiotherapy. But they're everywhere.
They're usually closer to the hospital.
Closer to the hospital or inside the hospital settings themselves.
Okay.
Yeah.
How about the chiropractics?
Now,
where can they find the services?
Okay, the services. But if I come to that, what I would emphasize is teamwork. All of us who practice in the healthcare arena, to know each other, to discover about between ourselves, know if you're a medical doctor, to come to understand the services of a chiropractor, respect them, then identify the various categories of practitioners in your community, and then come up with a referral network whereby you send the various patients to access all forms of services so that we keep a more healthy, productive community. Then where to find me, the practice which I initiated when I introduced myself when I came back from abroad, I've qualified in chiropractic. I established a unit attached to Mulago Hospital, chiropractic unit. It's in Old Mulago. But on top of that, I have joined my friend Sina at that place of Activator Therapy Center. So they call me if there is a need, if they have identified a person who can benefit from chiropractic, and I see them. But I should also emphasize, much as they have referred to you, the grounds are not very clear, so we need to cooperate. Even when a patient comes to me, they have referred to me, I still assess and see are they really suitable for chiropractic. If not, I use a referral network and refer and advise the patient accordingly. Excellent.
So you emphasize an important topic of referring patients, right? So I'm glad to hear there's a good network of referrals between the therapists And I am hopeful and optimistic that the network between the therapists and the medical doctors improves, so that we can explore different avenues. Not everything has to rely on medicines and tablets, right? Because it's kind of cumbersome taking tablets which are going to attempting to relieve pain, and it's not really getting anywhere. So if I know in the future these avenues will definitely be explored and strengthened, so that patients, you who are sitting at home, can have options, can have a variety of therapeutic options to pick from. If you don't want medications, you can choose to see the physiotherapist. Or if you prefer, you'd want to take the medication, fine, well and good. You can still take the medications, but just keep in mind that there are other alternative forms of treatments that are available to your disposal without having to take medications to relieve pain. So I want to thank you very much, gentlemen, Mr. Sina, Mr. Kayundo, and Mr. Sevwana, for taking us through the discussion of pain control without the need of a tablet, that painkiller. And you've heard it from the host's mouth, you know where exactly to find them. If you want to reach out to them, send in, you can reach out to us on our Facebook or Twitter handles, or we can refer you to the specialists themselves, or you can visit the actual addresses as they had mentioned earlier in the show. So we shall see you next time on the Doctalk Show. Have a good night.
The Doctalk Show.
UBC, inspiring Uganda.